very pleased to have on set Dr. Oura, who is a virologist, a veterinary virologist, no stranger to the program. We had you on very early with the onset of this virus, which is now declared a pandemic, and we spoke about that earlier on the program. Doctor, you know, there's so many things that people are concerned about, and you know, the media internationally especially creating this hysteria and people shopping and so on. But what really should we be concerned about here in Trinidad and Tobago?
So at the moment in Trinidad, we don't have the virus. So we're one of the fortunate countries where we're looking and learning about what's happening outside, what other countries are doing. There's an enormous amount to learn about how we can prevent the virus entering our country. But more importantly, when the virus does come, because it's very, very likely to come, what are the next stages? How we should try to delay the spread of the virus amongst our population. And that's critical, and we've seen it critical in many countries, because what we don't want is a sharp peak. Because if we get a sharp peak, that's going to put a lot of stress on our health services. It has to be set.
As was the case with Italy, for example.
Yes, exactly. Yes. And was the case in China at the start as well. So it's very important that we take the precautions that we're hearing about, the washing hands, keeping away from people who are sneezing, people self-isolating when they have the symptoms, so they don't come out into the general public, they don't come to hospitals, they don't come to health services, they phone telephone numbers and get advice. That's really critical, because we know this virus doesn't it affects different age groups of people. We know the majority of people are not going to get very severe symptoms, and we've seen that around the world. We know that there's been no cases of deaths in kids under 9 at the moment. People under 50, there's very few cases of severe symptoms. So it's the elderly people and the people with these underlying health conditions that we have to worry about. But it's all of us that are capable, if we get the virus, of transmitting. Even if we hardly get symptoms at all, we're capable of transmitting. And if we have our grandmothers or grandfathers or friends with diabetes and heart problems, those are the people that are going to be in trouble. So we shouldn't rest on our laurels as younger people. I'm not so much younger, but as younger people, and say, okay, we should be all right here. Yeah. We really have to think about the people in our communities, the people in our country. We have to work together as people from Trinidad and Tobago to make sure this virus doesn't spread quickly. So the few people that get the virus and have severe symptoms need to go into intensive care and be ventilated. The elder people, they have the opportunity to go into the beds and to get the medical medical things that they need at that time. So it's really important that we don't panic. It's really important that we take the precautions and it's really important that we flatten this peak and it spreads slowly, so we don't put pressure on our health services.
Self-isolation, and perhaps you do that at home, I'd imagine.
Yes.
But if you're living in a home with other persons, how do you take that precaution so that it doesn't spread in the home?
So this virus, it's very important that we all understand how it's transmitted. And I know people have said this 100 times before, but that some viruses are transmitted short distances, in what we call droplets. When we sneeze or when we cough or when we talk, the virus comes out of our mouths or of our noses, and then the droplets fall within a couple of meters to 1 or 2 meters, and they don't go into the air. They're not airborne. Other viruses are airborne. This is not airborne. So if we keep away from our people we live with, we move to a room, a separate room, and so we keep away from other people in the house, we should effectively stop the spread. The other way this virus is transmitted is these droplets, when they fall to the ground, they fall on something, you can imagine, because they're heavy. So they fall on our hands, they fall on a surface, and then our hands touch a doorknob. So we need to be careful about what we touch, and that's why disinfecting. And this virus we have to understand the virus as well. This virus is what we call an envelope virus, so it has a coat on it. And that coat is made up of what we call lipids. So when that coat is broken down, the virus is inactivated, and that coat is broken down pretty easily by disinfectants. It's not that. This is a pretty fragile virus. So that's why washing our hands well, what's in the soap and what's in that envelope, that coat, interact and it breaks it down and the virus is inactivated. So there is science behind washing your hands, and that's why washing your hands for 20 minutes, when you sing
seconds.
20 seconds exactly, 20 minutes is a bit long, 20 seconds exactly, and singing happy birthday to you twice, and going round your hands does kill the virus, as does hand sanitizers. And most hand sanitizers have alcohol contents over 60%, and it's the alcohol that acts as a disinfectant and kills the virus. So we're very lucky. Other viruses we know about, you might have heard about things like norovirus on cruise ships and things like that, much more easy, they're much more hardy. They stick around for a lot longer. But this virus is quite fragile, that's a good thing.
Persons are asking about vendors purchasing food outside and so on. How risky is that?
Well, it's not that. It's not so risky. As I said, this virus is relatively fragile. I mean, you know, it will sit around on surfaces. It's not so easily. It's not spread by eating it. So I mean, if you cook your food properly and things, it will kill the virus. I mean, obviously, there's always small risk if somebody sneezes on some food, and you know, like the droplets are on the food, and then you touch the food, and then you move the whatever's on the food to your eyes or your, you know, there's always these small things. But on the whole, the risks in that kind of thing, like on clothes and things like that, is more limited. What we need to think about is the main risks, you know.
Swimming pools.
And swimming pools and things like that, the risk is low. The risk is very low, because this virus, again, I have to say, is a fragile virus relatively. So we have to think about the most important ways that this virus is spread and how we can stop that. That's washing your hands, that's keeping away from people who are sneezing and coughing. But most importantly, if you feel you've got any symptoms, when we start getting the virus, not now, we haven't got the virus now, but if people, once we get the virus, if people start feeling they've got symptoms, most people won't feel much. We heard about Tom Hanks earlier. I mean, he had a little cough, you know. So then self-isolate at home. Call the numbers that we have from the Ministry of Health. Call your doctor. Don't rush into hospitals. Don't rush into health centres. Don't rush outside, you know, because then you're infecting people who are going to be possibly more affected by it than you. This self-isolation thing is what is going to be really effective at flattening this outbreak, so we can then leave our health systems and our beds to people who really need it.
Should pregnant women be concerned?
Well, no, pregnant women shouldn't be concerned at this stage. There's no evidence, although there is evidence with some other viruses, like that you get a reduced immune system when you're pregnant. There's no evidence at the moment that that's a real factor in making people more likely to be seriously affected. Obviously, pregnant women should take the same precautions as everybody else is, because their immune system is slightly dampened down because of the pregnancy. But on the whole, when you look at the list of comorbidities, you've got cardiovascular disease, you've got diabetes, you've got respiratory problems. Those are what seem to be the biggest groups of people that are actually succumbing to the disease or dying from the disease, or it's contributed, but not pregnant women.
And finally, the mask that doesn't seem to go away, even though we say it's not as effective as in the first interview we spoke about the mask.
Oh, the mask,
that is not as effective as people might think, but we're still seeing, you know, persons buying it and using it, and the prices escalating and so on. Has anything changed?
No. Well, masks do play a role in stopping the virus, especially if you've got signs. So if you're coughing and sneezing, you can imagine those droplets. The mask will stop that. So stop the droplets coming out. And also, if you're in close proximity to people who have the disease, like health workers, they need to protect themselves because they're taking samples coming up close, because it can be transmitted by that sort of contact within a meter. But generally, people wandering around the streets who aren't health workers, who are feeling fine, then there's no need to wear a mask. It's more important for the people who actually have disease. So if you had somebody in your house, for example, who had the disease, it would be good to put a mask on them. to stop it spread. And if you're health workers, they need masks. So leave the masks to that people who need them.
Thank you so much, Dr. Oura, and it's always a pleasure having you on the program, and I'm sure we're going to have you on again as this coronavirus continues to, take us,
Yeah.
All right, until at least we get a cure.
Thank you.
All right, thank you, Dr. Oura, virologist, veterinary virologist with the University of the West Indies School of Medicine, correct? Yeah. We're going to take in a few messages. As I said before, we have so many things happening. We also have World International Women's Day. We're commemorating, celebrating women here on the program, and it's Glaucoma Week, and we're coming back and we're merging the two. Listen to me, you need to stay exactly where you are, so do come back after this.